in a given hospital, right? There's a CEO and there's an executive suite, and even at my time in the military, I mean, I had commanding officers. That every time we'd have a change of command, I mean, there was a real you could feel a difference in leadership based on who was at the helm, for better or worse, depending on who was there, and that had a tangible effect on culture, and on just the day-to-day workings of that filtered down through all the different departments and branches and so forth. So I am a firm believer in top-down leadership being a good start.
So, needless to say, physician burnout, and I think healthcare worker burnout is at an all time high. From a brain health perspective, could you tell us what exactly is happening neurologically when someone is burned out? And what are some realistic ways that they can start to try to heal themselves without fully shifting their career?
Yeah. So yeah, I think burnout is made to be a lot more complex than it really needs to be. To me, burnout is really just a mismatch between expectation and reality. That's it. And like I said earlier, I think we all agree that we all got into medicine with an expectation that we were going to be able to help people and have autonomy and do things our way. And you get out in the real world, and we find out that's not the case for most of us, right? At least I think that's a big part of it. So how do we combat that? Well, I mean, you can either change your expectations, so you can realign. It's like what's the Vince Vaughn line in Dodgeball? Like, just find if I lower my expectations, I'm upset way less. It's not a good answer, obviously, but jokingly, that's one option. But the other is to ask yourself what can I do to improve my circumstances. And again, I think a lot of it, and I don't mean a heroic. You've got to quit your job, or if you're in a clinic and you got to go do locums to make more money or something, and then you travel your way from your home, and that's awful. Like I'm not suggesting anything like that. I mean, it's just getting down to the basics of what can I control in my day, i.e., again, back to just the lifestyle design. But how can I be more intentional about time with my kids, with my family, about my health, about my energy, about my nutrition? And I think just creating the space to do that in the first place, to just look at your day and say, all right, where can I recover some time here? And where can I be intentional about 8 hours of sleep? Where can I be intentional about putting my physical activity in my day? How can I be more efficient at work? And using some of these tools to help with this. Back to AI. I mean, we've got all these great AI note takers now that are helping get really solve the documentation problem that's become a bloat that we've all seen through training and through practice, right? I mean, for insurance reimbursement that's shrinking and documentation requirements that are getting more massive. I mean, you can now just wear a pen or just have it running on your computer, and you just talk to a patient and do an exam, and it spits out this beautiful note with all the CPT codes, and like you're done. So that's pretty cool. So I think the technology is that's improving. I think we're seeing some of that time reclaimed. But it really, to me, it's the little things, and it's opportunities for presence, for being grounded, and for gratitude, just in the small moments of the day, and then structuring a schedule around what does that look like to optimize, be more efficient, and just take care of yourself, as intuitive as that might sound.
In your book, you talked about how chronic stress affects the brain, impact the brain in very, detailed manner. Can you just briefly say here for the audience, how does chronic stress or emotional suppression, self-neglect affect the brain?
Yeah, there are a handful of mechanisms at play, but a lot of it comes down to chronic inflammation, which leads to neuroinflammation, which is like gasoline on the fire of premature cognitive aging and neurodegenerative disease and everything we don't want. Chronic stress interrupts sleep. Sleep slows down lymphatic clearance, leads to accumulation of amyloid and harmful metabolites, raises the risk of Alzheimer's, creates insulin resistance, slows down metabolic function, impacts mood. I mean, these mechanisms are all interrelated. So I think the stat is that I'm familiar with is that, over the past month, 50% of Americans report feeling chronic stress every single day. I mean, and 75% report feeling it, sometime in the last month. And those are just the people that report it. So those numbers are probably higher. Then it's the technology, it's the screens, it's the isolation, it's the job, it's the lack of alignment, it's the burnout, it's the gotta run here, gotta run there, running on fumes. I mean, it's again, it's the mismatch between the expectation and the life. and the design and the environment. And we've got to get those things gelled and in an alignment for this to fix itself.
Many healthcare environments, and I would say just like all corporate jobs, have started, well, maybe not started to become, but they're getting exceedingly more toxic emotionally and also psychologically. I mean, I can speak for us in healthcare that that's been the case for a while, and I think it's getting worse. Um, what effect does this type of workplace negativity have on people's brain functions? And how can physicians start like unlearning some of these negative? I mean, we talked about negative thoughts, but I think what I'm trying to get at is physicians have this like ingrained sense of perfectionism, like we have to be perfect despite like the abuse coming our way. How do we unlearn that?
To be transparent for a moment, I mean that's a matter of a deep personal topic that I've gone through in my own therapy, with on my own, and then with my wife Corey, and in couples therapy, because we're so ingrained, like you said, to never be able to make a mistake, because people's lives are in our hands. And while I think the idealism behind that and the intent is good, and that we want maximally trained providers to be able to take care of people before they put their hands on a patient, perform a surgery, or do anything invasive. I think we could all agree that there's that's probably, again, done with good intent. The reality is that this no room for error or expectation of perfectionism is just it is so unrealistic, because we're human, and to err is human, right? And we're going to make mistakes, we're going to miss things, that is going to happen. And I'm sure we've all beaten ourselves up, and I'm sure audience members that are providers have beaten themselves up over a missed finding, a misdiagnosis, a case that's gone wrong. We've all been through that, right? And it's horrible, and just bad things happen, and it's horrible. So how do we untangle that, or how do we unwind that, or reframe expectations? I think one of the most effective methods is by top-down leadership in a given culture. And I mean, these are big issues to solve, at a systemic level, without getting political. I don't know that the government is the best way or answer to do that, because that's a big problem to tackle with a lot of unique applications. But in a given hospital, right, there's a CEO, and there's an executive suite. And even at my time in the military, I mean, I had commanding officers, that every time we'd have a change of command, I mean, there was a real, you could feel a difference in leadership based on who was at the helm, for better or worse, depending on who was there. And that had a tangible effect on culture, and on just the day-to-day workings of that filtered down through all the different departments and branches and so forth. So I'm a firm believer in top-down leadership being a good start for this. And then the other way would be, kind of the grassroots movement, right, from the bottom up, and creating communities and podcasts like what you guys are doing, or writing books and helping share this information. So I think with those two approaches, eventually there's enough, positive pressure, that can meet in the middle and help solve some of this. But I think it's too big of a lift for people to do this on their own. I guess is maybe another way of saying this. That relying on communities, relying on each other, and then having a structure to follow, i.e., the leadership, is probably the way to tackle this. And does that start at the educational level? At the medical student level, at the resident level, at the attending level. I mean, there are different ways, and we could talk about implementing this, but I think it's doable.
That's great. That's great advice. And I agree with you that relying on breaking the silence, and holding the executive suites accountable, I think is a very important step towards the well-being, the positive culture. So if you could share one message with physicians who are silently struggling with burnout, loss of purpose, what would you say to them?
You're not alone, and it's okay. Many of us have been there. Many of us are there. There's hope. You've got a community of people that love and care about you, and I see nothing but positive on the horizon, as far as, again, to use you two as an example. I mean, they're like, we're seeing this paradigm shift of a grassroots culture shift that I've observed, of more people leaving traditional medicine, and not saying that they're quitting or throwing in the towel, but we're just, I think we're past the breaking point where we all feel something has to change, and that's happening. And I'm very optimistic and feel very positive about that. And you know, and I'm a believer in free markets and capitalism, and I think the ship will right itself eventually. I think that, you know, there's a fix, and I see technology and AI being a big piece of this. So, as the saying goes, if you're in hell, keep going, right? Or if you're going through hell, keep going. So, yeah, we're don't stop. I mean, if you're there, keep moving forward. You know, you utilize the resources you have, utilize your networks. You know, leverage your families, your loved ones. Listen to podcasts, educate yourself, and I mean, for crying out loud, if you can get through a decade and a half of higher order training that less than 1% of the people on the planet can get through, you're in a pretty unique club, and you are more than capable and qualified to figure this out. It's just about having somebody help you with the tools like what you guys are doing, which I just love.
What keeps you grounded and purposeful and mentally well?
Again, to be transparent, guys, this affects me as much as the next person. I mean, I am a victim of any and all of this as much as anyone else. And as the saying goes, you know, when people do research, or people go into, I was never a research person, but PhDs that go into research, you know, it's me search, right? People do this because they're interested in, you know, what they need help with. You know, it's I struggle with all of the same things. I mean, it's certainly putting these principles in place has helped me. I mean, being diligent about my, you know, my health, my exercise routine, about prioritizing sleep. I mean, certainly, you know, Sean and I were just chatting about a residency experience. I mean, I still remember my first 24-hour call and how awful that was. You know, we all go through that, and there's an opportunity to, you know, perhaps make that system better. And I know that's been looked at, and certainly programs have changed around this academically, but being intentional about putting these systems in your life. You know, another saying goes something to the effect of, you know, we don't rise to the occasion, we fall to the level of our training or our habits. And so put the habits and the processes in place that you can actually rely upon. You know, because life's hard, and you know, some days are going to be easier than others. And I think if you've got a system that helps, you know, not ensure perfection, because again, that's unrealistic, but at least that gets you there most of the time. That's about as good a place I think as we can be. But again, we've got to have that alignment between our design and our environment. That is so apparent to me, and I think there's a lot to learn from that.
Any brain health practice that you personally do every day without fail?
Yeah, so I mean, you know, my kind of my top five, the whole brain protocol, BRAIN being the acronym. So, you know, B, breath work, is sort of like the mindfulness meditation. R for rest or sleep. A for activity, exercise. I for intake, so nutrition supplements. Then N, nurturing relationships, community, that kind of thing. Of those are sort of that's my framework. If I am the most geared for and diligent about one of them, it's exercise, or at least intentional daily movement. I've got a pretty rigorous training protocol that I follow. I, you know, lift or do resistance training so many times a week. I do so much cardiovascular endurance training, or high intensity interval training. Flexibility is an area of improvement for sure. So stretching, as it were, but in recovery. But I mean, we're designed to move. There's no question. And so, I mean, again, we look at the, you know, the just the ample data on the association of exercise with longevity and every organ system. I mean, brain health, skin health, bone health. I mean, just pick a system. That's to me, that's the big one. And I think that solves a lot of problems when people can create the time for, you know, for intentional daily movement.
So offline, we were talking a little bit about what is new with Transcend Health. Do you want to give us the updates and where people can find you?
Absolutely. Yeah. So we have been, after listening to our group coaching clients and our peers and our friends, a message that has come back over and over is that people have asked for us to set up a concierge practice, and that's what we're doing. So I will be launching a remote virtual concierge practice. We're targeting a March, April release. So I'm not sure when this podcast is going to come out, but so this is March or April of 2026 that we're talking about. And the idea is that people will have access to an in-depth suite of labs, of whole genome sequencing, of gut and oral microbiome, of a variety of imaging. So, MRI brain, whole body MRI, low-dose CT chest, heart, DEXA scan, the whole nine. And we've got several tiers that we're going to have, so people can just do the labs, do the imaging, get the diagnostics, have an assessment with me, and then take that back to their primary care physician and say, hey, here's some data that we can make informed decisions about. Or if people want to continue longitudinal care with me in the practice, that's an option as well at different levels. We're really, really excited about it. And while there are some centers that do some or parts of this in different parts of the country, it still involves travel to given locations, and they're usually in a New York or a Miami or a big city. And we're based in Atlanta, but I've wanted to offer this more broadly. And through my work in locums, I've just realized how many healthcare deserts there are in the United States, which is crazy. I mean, there's such a dearth of access. So I want to try to expand that. So that's part of the mission there, and then centralizing data for people as well. So a lot of people that do this still have to kind of DIY their way through it, where they go here for imaging, they go there for labs, they've got this specialist here or that person there. So to bring it all into one place in a dashboard that looks at that, looks at wearable devices, for example, and we can track all that in real time. I think it's going to be a really neat program for people. So that's the big one we've been working on.
This is great. Will this be nationwide, or you're targeting certain states?
Targeting certain markets to begin with, and that has a lot to do with our network. And obviously you all know this because you're in this field as well. But licensing considerations. So I envision this within, well, depends on how it goes, I suppose, but within maybe 2 to 3 years being a nationwide service. That could be within 6 months, depending on how things turn out. But I would like to expand access as broadly as we can, as quickly as we can, so long as we can maintain the level of quality and precision that I aim to offer people.
And so, where can people find more information on this?
Yes. So transcendhealthgroup.com is our website. I'm sure we can post that in the show notes, or you all can. We're building a separate website directly for the concierge practice. I own a couple other domain names, so we're actually, the team and I are still figuring out what that's going to ultimately be. But there will be a link from transcendhealthgroup.com, and we also plan to have a landing page where people can sign up to learn more. So that should be actually up and running very soon, or perhaps even by the time the show's out, maybe up and running. So TBD on the website name, but if they go to the main website, the link will be there for them to find it.
That's great news. Well, thank you so much, Ryan. Thanks for coming back. And hopefully we can do this again, maybe in a few months or a year, once you launch the concierge practice that is much needed. And thanks to the audience. Thanks for tuning in to Be Empowered, the podcast. If you enjoyed this conversation, don't forget to subscribe, leave a review, and share it with someone who needs to hear this. Stay strong, stay empowered, and we'll see you next time.